welcome students to the Rashmi's classes. Today's we'll discuss on NCERT Class 12 Biology.
NCERT Class 12 Biology. Chapter 3 Reproductive Health. 3.3 Medical Termination of Pregnancy, MTP. Intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy, MTP, or induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts to 1/5 of the total number of conceived pregnancies in a year. Whether to accept/legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious, and social issues involved in it. Government of India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female feticides, which are reported to be high in India. Why MTP? Obviously the answer is to get rid of unwanted pregnancies either due to casual unprotected intercourse or failure of the contraceptive used during coitus or rapes. MTPs are also essential in certain cases where continuation of the pregnancy could be harmful or even fatal either to the mother or to the foetus or both. MTPs are considered relatively safe during the first trimester, i.e., up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. One disturbing trend observed is that a majority of the MTPs are performed illegally by unqualified quacks, which are not only unsafe but could be fatal too. Another dangerous trend is the misuse of amniocentesis to determine the sex of the unborn child. Frequently, if the foetus is found to be female, it is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and the foetus. Effective counseling on the need to avoid unprotected coitus and the risk factors involved in illegal abortions, as well as providing more health care facilities, could reverse the mentioned unhealthy trend. 3.4 Sexually transmitted infections, STIs. Infections or diseases which are transmitted through sexual intercourse are collectively called sexually transmitted infections, STI, or venereal diseases, VD, or reproductive tract infections, RTI. Gonorrhoea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis, and of course, the most discussed infection in the recent years, HIV leading to AIDS, are some of the common STIs. Among these, HIV infection is most dangerous and is discussed in detail in Chapter 7. Some of these infections, like hepatitis B and HIV, can also be transmitted by sharing of injection needles, surgical instruments, etc. with infected persons, transfusion of blood, or from an infected mother to foetus too. Except for hepatitis B, genital herpes and HIV infections, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swellings, etc., in the genital region. Infected females may often be asymptomatic and hence, may remain undetected for long. Absence or less significant symptoms in the early stages of infection and the social stigma attached to the STIs, deter the infected persons from going for timely detection and proper treatment. This could lead to complications later, which include pelvic inflammatory diseases, PID, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. STIs are a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care program. Though all persons are vulnerable to these infections, their incidences are reported to be very high among persons in the age group of 15 to 24 years, the age group to which you also belong. There is no reason to panic because prevention is possible. One could be free of these infections by following the simple principles given below. I. Avoid sex with unknown partners/multiple partners. 2. Always try to use condoms during coitus. 3. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with infection. 3.5 Infertility. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile, i.e., they are unable to produce children in spite of unprotected sexual cohabitation. The reasons for this could be many: physical, congenital, diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized health care units, infertility clinics, etc., could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be assisted to have children through certain special techniques commonly known as assisted reproductive technologies, ART. In vitro fertilization, IVF, fertilization outside the body in almost similar conditions as that in the body, followed by embryo transfer, ET, is one of such methods. In this method, popularly known as test tube baby program, ova from the wife/donor, female, and sperms from the husband/donor, male, are collected and are induced to form zygote under simulated conditions in the laboratory. The zygote or early embryos, with up to 8 blastomers, could then be transferred into the fallopian tube, ZIFT, zygote intrafallopian transfer, and embryos with more than 8 blastomers, into the uterus, IUT, intrauterine transfer, to complete its further development. Embryos formed by in vivo fertilization, fusion of gametes within the female, also could be used for such transfer to assist those females who cannot conceive. Transfer of an ovum collected from a donor into the fallopian tube, GIFT, gamete intrafallopian transfer, of another female who cannot produce one, but can provide suitable environment for fertilization and further development is another method attempted. Intracytoplasmic sperm injection, ICSI, is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility cases, either due to inability of the male partner to inseminate a female or due to very low sperm counts in the ejaculates, could be corrected by artificial insemination, AI, technique. In this technique, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus, IUI, intrauterine insemination, of the female. Though options are many, all these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. Therefore, these facilities are presently available only in very few centers in the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of all these procedures is to have children, in India we have so many orphaned and destitute children, who would probably not survive till maturity, unless taken care of. Our laws permit legal adoption, and it is yet one of the best methods for couples looking for parenthood.
Thanks for watching the video. Please like, share and subscribe.